Hello, good evening, and welcome to today's patient meetup. Uh, you can see some faces on cameras, all the others are hiding behind the screens. Uh, Before we start the session, before we have a short, quick 30 to 40 minutes meetup, which we regularly do as a part of our community building and as a part of our support to the migraine patients whom we are treating. We would like you to open up the videos, get settled somewhere in the room so that you can be here completely, physically, psychologically, emotionally, everything. Right. Hi, good evening. Good evening. I can see many more faces. Thank you for opening up. Thank you for showing your faces. Yeah. Can you hear me loud and clear? Sitara? Yes. Arushi, can you hear me? Right. Thank you. Right. Somebody is messaging that they're not able to hear me. Right. Okay, so welcoming each one of you once again for this evening. We'll be spending some time, like almost like 30 to 40 minutes. And before we go in directly deep dive into the objective of the session, I would really like to appreciate each one of you to investing this time on yourself. It's pretty hard, like for after a long day, most of you are working, and after a long day, Wednesday, and you are like tired, and you have been home, and you're asked to get into some sessions. But why we really encourage all these sessions and engagements is like such consistent engagement actually accelerates healing or accelerates cures. The more you are aware about yourself, the more you are aware about what is happening in your life, more of you are aware of what is migraine, more you are aware of what is happening around the world, and how we need to be prepared or how we need to evolve ourselves on the space of migraine cure. That is how we really face things, and that is how we really understand stuff, and that is how the healing process is happening. So the main objective of this today's session is only just two things, very very small things, but it is really important two things. First of all, we'll be dealing with some of the real emotional factors that affects migraine, and we will also deal with some of the common mistakes which I see of late in many of the patients who are taking our medications, but really finding it difficult that they tell that medicines are not working, and headache drops is not giving us results as you have mentioned. So all these things we are getting on and off from the patient. So we would like to have a conversation regarding that common mistakes that you are making, or common knowingly or unknowingly we are committing so many mistakes in taking the medicines. So we would like to correct all those things, and before that we will deal something with um, the emotional factors or the real emotional factors with which we are suffering, or we are having something like a root cause of migraine or something. So each one of you, I believe that, or at least most of you have joined the poll we have placed in the group, the community group. So the majority, like almost like 40 plus, almost like 130, votes were there, or more, much more than that. Almost 40 plus of them have voted for stress and emotions as the key challenge they are facing in their life. So I would want you to, I don't know how many of you have actually participated in that poll, but I want you to type in the chat box, what are the emotional challenges or what are the stress factors that you feel, or right now what are you feeling that you think that that is the root cause of my migraine, or that is the that can be causing my migraines. Can you please chat in the can you please type in the chat box so that I can get to know where to start from, or what are the challenges you face in the emotional sector wherein you think that okay, this is my problem. I have seen also so many people, voting for some other things like sleep patterns, food patterns. Some are related with stress factors like overthinking, or with career or finance. Yeah. Loshan has told overthinking. Yeah. Netra is any inconvenience. Okay. I'm mostly I'm asking you to put up the emotional things, or in one word or something. What emotional things are you worried about, or what emotional things are you, you know, yeah, okay, marital issues, obviously. Yeah, there are a lot of it. Yeah, stress due to infertility and overthinking. Yes. Yes. What else? How about others? Don't be a onlooker in this session. Let us participate fully. I need to hear from you. Swati is telling, no one understands me. No, it takes too much stress. Yeah. And everything will be disturbed. Okay. Sitara, any emotional triggers? Yeah. Can be childcare, yeah, career, connecting with toxic people. Yeah. Good that at least Sitara, you are connecting, or you are like you are knowing that you are connecting with toxic people. That is a lot of awareness which most of the people don't have. I really appreciate that. Yeah, Manullah, for him it is office work pressure, loneliness, overloaded. Okay. Uh, okay. Divya is writing some, big sentences like, okay, 4 to 5 days we have found, okay, dad is sick. Okay. Household work. What else? Oh, we're going in for permanent food and stuff like that. Career settlement. Okay, fine. Okay. Coming back to the leaving family and working overweight due to PCOD issues. Okay. Uh, so yeah, Swati is understanding or is aware that she is shouting too much to everyone. Okay. Somebody have named like Hetarth. Can you please rename your name? I don't know whether that is your name, real name. Yeah, Nino, difficult to manage career, house, chores, kids care, overthinking, Priyanka. Okay, fine. Right. So there are a lot of issues. There are a lot of things that we are facing on a day-to-day basis. So when I like since few days, I was randomly connecting with few patients. We have my patients. Usually, the follow-up calls, as you all know, the follow-up calls are done by our consultant doctors. So, of late, I took up the opportunity of connecting with you all in the follow-up calls, and many of you were telling that while taking the medicines, I'm better, or while taking the medicines, the frequency has come down, the intensity has come down, but that issue, that is causing me problem. That guy, that person, or that incident, so each of us have something or the other which we are hooking on to. And these emotional stress, as we always have, we think that we cannot live with it, or we cannot move away from it. And we tend to tell the same phrase, or tell the same sentence which society or your family might have told you already, like, this we have to live with. This is the anxiety that you will have to live with. This is the tension that you will have to live with and die with. So you will not be able to get out of this. That is the concept of that is a thought process that we usually have. But is there some way out? And when we dig into the social media or YouTube channels, and I've seen many of the neurologists, or maybe even doctors who are focusing on migraine and stuff, telling people that so many unrealistic expectations, or so many unrealistic things I have heard people asking patients to do, like avoid stress. That is the first thing. To bring down the migraine, you have to avoid stress. Or they'll tell you, don't take up stress. Okay, if your job is stressful for you, leave your job. If your husband is stressful for you, leave your husband. Is that an very easy thing to do, or will that give us more stress? I always wonder. And I have found in this world, people who are in this world, there is only one category of people who are not at all stressed, and that category is in cemetery, or is in the tomb. Okay, the one who is breathing, the one who is moving around, the one who is having some, pulsations and life and heart is beating. Please understand, the stress is a common factor for all of us. So it is not the stress which is causing you headache. If that was the case, and I'm just generalizing it, it is not an overgeneralization, but out of my 20 years of experience, I have seen thousands of people who tell me that, sir, it is not only stress, it is my night duty which is causing. Sir, can you give me a letter asking my manager to get me out of this night duty? This is the usual request we get in Ayush Care. So we tell them that there are millions of people who is doing night duties. There are millions of people who are taking up odd timings because India is a very hub for all the European and US based companies, and when we work in the US timings or UK timings, it is much difficult for us to be in that timing, especially for software engineers and people who are dealing with NRI clients. So there are millions of people who are taking up these odd timings in the job, but there are only few or maybe thousands or maybe lakhs, I don't know, but there are only few people who are having migraine. If the night duty is the cause for the migraine, what do you think? If you shift your duty to a day duty, will your migraine be okay? Will your migraine vanish? Absolutely not. Absolutely not. I know thousands of people who have tried that. I know thousands of people who have tried things like going on a trip, going on a vacation, going on meditation sprees, and going on a spa. And they'll ask doctor how I can live a life stress free. So they'll advise like do yoga, do meditation, go for a spa, go for a something like warm water bath and stuff like that. These are all helping. Yes, these are all helping. But are they really committed to help you with the root cause? Absolutely not. And there are people, and these days I am getting many people or multiple people who are coming and telling me that, sir, my neurologist told that it is because of stress. And I went for a picnic with my loving husband. I love him so much. We are having a beautiful relationship and we have two lovely kids. And still on that resort where we were enjoying, relaxing, having games, having food and fun, 5 days we stayed there. 4 days I had migraine. I had to take injections. So what is migraine then? Mm. So, please understand migraine is not just a headache. This is I say this a million times. Migraine is not just a headache. Migraine is not just physical. Migraine is not just a pain which can be relieved or which should be relieved by painkillers. It is something deep. So such emotional triggers and such emotional aspects of it definitely have a role in amplifying the pain. That is what I call it. Amplifies your pain. When you're work stressed, when your family relationship is stressed, when your emotional portion is stressed, definitely it will amplify the pain, but that is not the root cause. So, what is the root cause? If we ask me, I would definitely tell that is the stress you are creating yourself. Who will create stress for ourselves? You might think, who will create a grave for ourselves? Who wants stress, sir? We don't create stress at all. But please understand, knowingly or unknowingly, there are some parts of the mind like conscious, subconscious, subconscious and unconscious mind is very tricky, and we don't know what this mind is playing with us. So subconsciously, today I spoke to a medical professional. I cannot reveal the details of the person, but she's hailing from Hyderabad. I spoke to her today evening. She's taking my medicine since long time. And if a person is taking a medicine for a long time, one thing is for sure, my medicines are acting. That is why she's taking. Otherwise, she would have stopped in the first month itself. So my medicine is acting and she's continuing the medicines. And I was constantly asking her, what is happening? So she every time when she talks with me, she tells that, sir, that is not proper. This is not proper. I have these kind of problems. I have now allergies. I have now I have bleeding issues also. Now I have issues with my in-laws. Now I have issues with my boss. Now I have issues with my family, neighbors, even pets. Every time she's coming up with some or the other reasons, and I really asked her, are you really committed and are you really focused in curing your illness? Surprisingly, she did not have an answer. She was taking a pause. She was thinking for herself, why am I getting into the vicious cycle of sorrow, suffering, pain, sorrow, suffering, emotions, anger, again crying, again pain, again migraine? There is multiple vicious cycle which we are moving around. Some people we have the awareness, like somebody mentioned that I'm having issues with toxic people in my life. Some people don't even have the awareness. And some people, I would tell you, we are the toxic people for somebody else. And how toxic are we to ourselves, we don't know because we are not aware of what is happening inside us. So there are a lot of things which is going on inside us, and that is why when we take the root cause analysis case taking pattern, we ask deep questions. Like we ask to dig deep, starting from the life space itself, starting from the childhood itself. And the first sentence, which most of the people beautifully hide and smile and tell me is, "I had a happy childhood, sir." I will tell them, I agree. Okay, then I'll ask again, okay, how was the childhood really, literally? No, sir, my parents were very good and they were working and I had a happy childhood. Then I ask them again, okay, how was the childhood really? How did it feel to you? What was the emotions you are going through? Then they'll be like stuck. The first answer they gave me was the answer for the society. Like we meet somebody and we ask them, how are you? Have anybody told that, no, I'm not fine? We'll tell, I'm fine. Thank you. And we'll ask, how are you? And the other person also will tell, how we are fine. Okay. So this is the conversation that we are having. And the third time and the fourth time, if we ask the same question, that same person who told me that the childhood was uneventful and childhood was happy and I was all good, the same person have told me that my childhood was pathetic, sir. I had a hell of problems. And I see different patterns emerging. When we see thousands of people, thousands of migraine patients, we see that there are certain patterns emerging. There is a pattern where I see most of them. I got two patients right today. We had two new patients. One is from Tamil Nadu and one is from Kerala, directly who came directly to my hospital. Two of them had the same history of they told that childhood was uneventful and happy and all, but they both told me that I was brought up by my grandparents. I was brought up by not by by my parents, but I was in my uncle's place. I was in my joint family, so I missed my parents. And those missing when she was a child of 6 years, 5 years, or even younger than that, or even and whatever happens to you in your life before 10 years, I would definitely tell that will have a lot of impact on your adult life. And that is creating an emotional suppressions wherein in that age we are taught only to swallow things. We are only taught to chup raho, like don't speak out, don't cry. If you're crying, you are a crybaby. If you're irritating somebody, you are irritating somebody. So we tend to not to irritate others. And these people who has a background of childhood traumatic experiences, it need not be something grave like big issues like sexual abuse or I had lost my mom or some great or big events that need not be there. This can even be a simple problem like I got an younger brother when I was 7 years of old, and I was jealous of him because everybody wanted to be with him and everybody wanted to, caress him and carry him, and I was not okay with that. People might not have even opened up all these things. People might not have even told anyone about these things. But the instant we go there, we know that something is problematic there. Some issues are there unresolved. And please understand when I walk through the lives of adult people who is having migraine, I see another patterns coming up like overthinking. Even when I asked about putting up your emotional status or emotional problems in your chat box, two or three people have typed like overthinking, overindulgence, or over involvement. And most of us tend to be a perfectionist. Most of us want things to be very paka paka. Most of us want people, we have a nature of people pleasing. We go out and help people even though we are in trouble. 2 days back, somebody told me that she's a pet lover, and she told me that in the apartment or in the whole society, housing colony, housing society which she is living in, if even a crow falls down, with some electric shock or something, midnight also she'll get a call. Even if she is having migraine, she'll go out and help that crow. That is the amount of people pleasing and love and affection which is flowing outside yourself, but these kind of love most of us don't have for ourselves. we tend to ignore, we tend to people please. And surprisingly, when I talk to people, when I talk to patient personally, I might have told some of you also, I might have started to predict your nature. I might have started to predict your things like, are you like this? Are you irritated by this incident? Are you getting angry in this? Some people have told me that I'm getting really irritated by presence of some people. And there is a pattern. That type of person, that type of incident, that crucial situation, you are not able to manage. And you have been thinking about all these things. You have been knowing all these things, but you are not very much clear what is really happening inside you. You are not clear why this is happening inside you. And we tend to overthink. There are even people who tell me that I overthink even when a person doesn't reply to me, in WhatsApp or in chats or something. When I have a delay in replies, I asked something or I started a conversation and I didn't get reply for 2 hours. That's it. We start cooking up our own stories and we start even seeing that happening. Whatever we have just thought or imagined or fantasized, we start to see evidences that, okay, now she is not responding because she had heard something about me or she doesn't want to get in touch with me. Maybe that poor girl or the poor guy is admitted in a hospital, or his phone is like switch off, or his phone is like, maybe the service center or something. We don't know the realities, but we tend to overthink. And will this affect our relationship? Yes. Will this affect our relationship with our kids, with our husband, with our spouse, with our parents, with our in-laws? Yes. And will this give again more pressure and more intense issues or tension and stress for our mind? Yes. And will this cause migraine again? Yes. So if you are going with the patterns, if you are flowing the same flow of patterns, same flow of emotions, please understand that we have to fly out of this. We have to fly out of these emotions. Only then we'll be able to conquer this pain. It is not that you have tried all sort of painkillers. I can tell you that most of you have tried all sort of painkillers, starting from crocin to inflammatory painkillers to vasograins to migrainal to flunarizine to injections to shots to even Botox injections. You have tried everything. And you are like, sir, nothing works now. So I'm ready for everything, anything. You tell me what to do, and nothing works for me. And people are even afraid when I tell them how to take my headache drops and how to get relief. They'll tell, sir, even neurological medicines are not helping me, so this will not help. I took it for 3, 4 times and it's not working, so I stopped. That is a way most of the people are responding, because they have told themselves 1,000 times that nothing is going to work, because they have heard themselves and doctors and the society and the family members telling that this is for life. This is your death sentence, that you will have to live and die with migraines. Please understand there is a way out. As I am a medical practitioner who is registered in a medical council, I am not supposed to tell you things like in a meeting or in a public thing or anywhere. I am not supposed to tell you that we deal with migraines or we cure migraines, or there is a cure for migraine. That is actually illegal on me. But I have seen people curing migraine. I have seen people walking out without any pains. Those who have come up with 25 days of pain in a month, 50 painkillers a month, 70 painkillers a month. You won't believe the intense pain and the intensity of patients who have taken the treatment and who came out with a beautiful life, who are thanking me for life and sending in many patients who were suffering, they see in the society and they send them to me because they have seen themselves transforming. Is it only the medicines? No. Is it only some therapy or something? No. But is it a combination? Yes. Is it a combination of changing perspectives of mindsets? Yes. And do we have a scope of changing mindset? Please understand the answer is yes. Please don't think that, sir, I am like this. Nobody can change me. I have tried a lot. I have tried even going to counseling. I have tried even going to therapy and nothing worked. So I am like this. So we also tend to tell our spouses that, mind you, I am like this. If you want to adjust, adjust. Otherwise, you can, take your decision. I'm like this. Please understand there is a way out. Please understand you don't have to be a person who is ill-fated, or you tell that, like society usually tells us that, okay, you are stamped as a migraine patient. That stamping is not for life. There is a way out. And there is a solution. I'm coming to that, Divya. Don't worry about the solutions. We are already on the first step of solution, and I really appreciate that how you manage to tackle the pain and how you manage to, get on with the medicines. Sometimes it is very difficult. I really know. I really know it is difficult. Sometimes even my medicines are not helping. Sometimes you take the headache drops for 10, 15 times, it is not working. After that, you are taking some painkillers, it is not working. Somebody have asked me here, like, is emotional issues trigger sinus headache? Pachemal, I would tell answer like, see, though I have mentioned that you have issues with sinus also, these can be problems where it is coexisting. You can have multiple problems coexisting. You can have migraine as well as sinus issues at the same time. And please understand, one can be the trigger for another also. So if you have a chronic sinus issue, this can cause migraines, and the underlying things can be really sinus issues or really the emotional issues that I've already mentioned to many of you. If you remember, while I was taking the case, I might have told you that in psychology, we tell that all the emotional suppressions can cause the suppression of sinus functions, or can cause emotional, or can cause inflammation in the body. This is scientifically proven that emotional issues or the suppression of emotions can cause inflammations in the body. Some people it will be sinus, some people it will be generalized, some people it will be in the area of the neck or the muscles, some people it might be in the gastric area where they cannot eat any food, they have problems with some food items, they have problems with bloating, constipation or diarrhea and irritations and stuff like that. So these inflammations can create havoc in many parts of the body. So whenever you find that your headache is triggered by some food material, don't blame that food material. It is your response to that food material. It is the body's inflammatory response to that food you're intaking is creating a problem. It is not the food is creating, because if you are having problem with mayonnaise, for example, or if you're having problem with cheese, please understand cheese is not the problem. Avoiding cheese will not heal you, because there are millions of people who are having cheese and they don't have migraine. The problem is that you have a problem with cheese, you have a problem with sunlight, you have a problem with emotional triggers. The common denominator is us, not the triggering factors. And that is why I generally tell you all to ignore the triggers, ignore running behind the triggers. People are, even when they take medicines for 1, 2, or 3 months, they are still behind these triggering factors. They'll still write that, "Sir, still coffee is triggering me, still fermented food is triggering me, still I took one orange and it's triggered my migraine." I ask them to take all the things which every human being is taking and see to that the headache, the frequency is coming down, the frequency, intensity, and duration is coming down. That is how you heal. You have had restrictions enough. You have had multiple restrictions all through this life, and that has not helped you. And the moment you start to have some restrictions, you will definitely find that you will start to get headaches from some new things. And you will have to start restricting that also. That always happens. I stopped ice creams, or I stopped mayonnaise. Then the, cheese is giving me plus problems, like pulses is giving me problems, or something else is starting to giving me problems. So one thing we stop, one trigger we stop, or one trigger we avoid. Please understand there are thousand other things waiting to trigger you. The problem is what is triggering inside you. The problem is what is this actual stress you are going through. please understand what we are seeing with each other, like the people who have switched on the camera. We see each other like this is our physical body. And we have an emotional body which is invisible, that is there, and that can be seen in certain cameras, and that can be emotional body is visible with our naked eyes. But scientifically it is proven that there is an emotional body, and we usually depict this as aura, around the Jesus face or Krishna's face. We see that aura in the head, no, we draw that aura, and we have that emotional body. And the actual problem for migraine patients is in that aura, is in that emotional body, where the childhood or the past traumatic experiences have not healed. And when the wound is not healed, please understand, these wounds doesn't only leave scars, these wound will definitely be raw, and this raw wounds will transfer the issues to the physical body. It will cross the mind body border, and it will cause pain in your head. And that is why we call migraine as a psychosomatic illness. And there are beautiful connection between stress hormones and anxiety, stress hormones and emotions, stress hormones and migraines. And that is why most of the people get menstrual migraines, because those days some of the hormones get imbalanced, some of the hormones are excess, some of the hormones are depleted, and that will always trigger migraines. And some people tell me that whenever I think of migraine, I can even produce migraine, some people have told me. If I think, or if I'm afraid, if I'm scared that, okay, I'll go to the party in the evening and I might get migraine, the person will be thinking in the morning, and the same thing will happen. Evening, they'll go to the party and they'll have migraines. So people have told me why that mind is obeying me so much. The mind is mirroring into the body. That is called as body mirroring. Whatever you think as a reality, you have the capacity to mirror it to the body, and this will create physical pains. Please understand, there is a way out. And that is where we have created a program called as Swasti, where the term Swasti is called the pause. That is the pause you really require. You might remember when you talk with me on a call, like on a follow-up call, I usually get people usually flow with the complaints or flow with the words. There will be a vocabulary vomiting will be there. They'll be like, so I have this problem, sir, that problem, sir, this problem also is there. Now this problem also started. Like, I'll be like, okay, you take breath and, tell me one by one. They'll be like flowing with things. I always tell them to pause. And Swasti is the 2-day pause which we have created. And we have treated people even without this Swasti kind of programs also. We have treated with just homeopathic medicines, and we have got results also. It is not that from time immemorial we are doing this Swasti program. No. 15, 20 years back, I used to treat migraine patients only with homeopathic medicines, and people used to get better, but they used to come back after a few months, after a few years. They'll come back and tell me that, sir, get me the old records and get me the same medicine which you gave me last 6 months back. You had healed me that time, but something happened in my life. I lost my husband, or I lost my parent, or something, or I am into some emotional traumatic experience, and again this thing is coming up. So that is where the importance of working deep into the third layer. When you're taking medicines, we are only taking care of your body. We are only taking care of the inflammations in the body. And when the inflammation starts to come down, you will generally feel within 6 to 8 weeks, I can tell you, you will generally feel that your intensity of headache is better. Most of the days you are not having headaches. Most of the headaches are not that intense, and I'm able to control it at least with painkillers, or most of the headaches I'm able to control with headache drops. Sometimes I don't even have to take headache drops also. This is just a congestion that I have in my head. So these changes is happening because of the physical effects of the physical medicine which we are giving you. That will initiate the cure in the physical part, bodily part. But if only you are committed and focused to go deep inside your thoughts, deep inside your patterns, so that you understand the, neurochemical imbalance which is happening inside the body. It is purely individualistic. The body or the mind or the makeup of Sitara is different from Maharishi, it is different from Riddhi or Shruti. It differs from patient to patient. There is no one way solution for all. There is nothing like one quick fix method is there for all. Everybody is having multiple layers and everybody is having their own perspectives and their own severity scores. And, I'm not talking about the pain scores, but I'm talking about the severity of the trauma they have been through. And there is no single person in this room who can tell me that, no, sir, I never had a problem in my life. If you ever think that you never had an emotional problem in your life, either you're mentally challenged or you are not alive today. There are only two chances. If you were not mentally challenged, please understand there are thousands of things which have traumatized us, knowingly or unknowingly. And this will mold us. This will mold us to some different pattern. And that pattern is actually the pattern of migraine patients. And that is what I see in common in all of you. Most of you have the same kind of tendencies. Most of you have same kind of allergies. Most of you have same emotional wavelengths. Most of you have same vulnerabilities towards crying. Most of you have same irritability or getting angry or getting irritated on slightest stimulants or stimulations. So all these patterns, how it is impacting the body chemistry, how it is impacting your neurotransmitters, and why you are generating the inflammation in your body, which is creating havoc, and that we call it as migraine. That we have to work out. Only then you can find a relation between, okay, what is the stress? What is the emotions I have to take care of? Or what are the emotional things which is bothering me right now without even my knowledge? So when people understand sessions like Swasti, they tell me, sir, I never knew such a problem existed within me. And I was not aware that this was creating a havoc inside me. And they have thanked me after the Swasti program, telling me that you have answered me, though we have not connected personally and you have not asked any questions to me, and you were just explaining few things, the general principles of psychology and stuff like that. But I got almost like 10 or 15 questions answered inside my mind, which I was carrying since childhood. I had all these thoughts like, why am I like this? Why am I getting irritated with this? Why am I getting such relationships only? Why am I stuck in life? Today morning, I spoke to one gentleman from Pune, and he was telling that, sir, everything in my life is fine, but since 2 years, and I'm stuck in my career. I cannot move on. And there are some people who tell me that, sir, whatever happens, any relations come, it doesn't stay with me. Whatever happens, something happens, and that relation get cut. And some people tell me that I am trying to crack my exams, maybe competitive exams, maybe IAS exam, maybe CA exam, maybe government PSC exam. They are trying to have this kind of a competitive exam. They are trying since many months, multiple times they have appeared. They are studying well, they are performing well, but they are skipping. They are just not the when the results come, they are just not seeing it through. And why are these patterns having this similar kind of things? Why are these people telling me that I am stuck? This stuckness is due to some emotional baggages that you're carrying inside. And I have even seen beautifully people coming out when the pain have come down, when they have the commitment and focus to work on themselves. I've seen people cracking exams. I have seen people going in for beautiful relationships. I have seen people their relationship turn around a 360 degree, and they call me up and tell like, When I got it sorted, I see the whole world changes. When I started to see what is happening inside me, when I started to honor what has happened inside me earlier, when I started to listen to myself, now I understand why I was stuck. That is a process that we are inviting you all to be a part of. That is why attending 2 days Swasti online program is so important for you. And that is the next step in your healing journey. That is the next step that you should be taking in your healing journey. Most people think that you are a doctor, sir, you are giving medicines and I am better. Why I should come for all these webinars and stuff? And I am super busy that I don't have time. People always tell me that Saturday and Sunday I'm super busy, sir. Saturday is my working day, and Saturday I have meetings with my clients, and Sunday I'm with my family and my in-laws, or I don't have time for all these things. But the same person have sat with me for an hour or 2 hours and cried over the headache and told me that my life is lost because of migraine. I am missing more days of work. I can't be with my kids. I can't be with myself. I can't even go out for a movie, do something for this migraine. And when it comes to the commitment, when it comes to the point where we invite you to commit yourself and be focused, we often find an excuse. We often think that, okay, this is not important. I'm taking medicines now. Let us see the medicines. Let us see how the medicines are acting. Medicines will definitely act for you. I'll tell you, with that confidence, I can tell you that we are having a cure rate of 70 to 80 percentage minimum of the patients who are really taking the medicines according to the instructions that we are giving you. We have given only few restrictions, like 3 restrictions I have given you. One instruction I have given you to follow up the migraine diary. And regarding the headache drops also, I'll again explain once more how you have to, or what are the mistakes that you are doing when you take that medicine. If you are following this, I can tell you that 70 to 80% of your migraine will be going, and 70 to 80% is the cure rate that we have in migraine cases. If that is happening, if that is happening, how much more you should be obliged to yourself, how much more you should be committed with yourself, so that you are seeing to it that it is not coming back again. And this is exactly why we focus not only on medication, but also on emotional healing. And that is how we devised a session called as Swasti and the follow-up session. And many of you have mentioned, like, something is blocking in me, some emotional blockages are there, I'm not able to identify. And that is what exactly we'll be addressing in this 2 day session. And it is not going to be a lecture mode. It is not going to be a monologue mode. It is going to be a discussion mode or group discussions. We'll have deliberations. We'll have short sessions of meditations or breathing. There are lot techniques. Many people ask, even now you are asking me like, what is the solution, sir? What is the solution? I'll be giving a list of things for you to understand, as well as that which you can practice in your day-to-day life, so that you are more aware of who you are, and so that you can be winning with this war of migraine. So please understand, don't trust any medicines for that matter to the 100% core, because there is nothing like a medicine for migraine. My medicines are doing its job. And here Shruti is telling that only a few days I started my medicines and she's getting better. She knows that inflammation is coming down. Definitely. That is what we see in each and every patient. But please understand that these medicines will do its part. But what is the role that you are playing in your own healing? And that is how this is going to turn out. So, with that, I will stop and I will invite you once again for the program, the 2 day online webinar called as Swasti, which is happening on Saturday and Sunday, the October 11th and 12th. If at all anybody have not registered or anybody is not informed about that, my team will share the Google form right now in the chat box, and you can fill in that Google form and we'll get back to you with the links of the meetings on October 11th and 12th, Saturday and Sunday. Here is the Google form. And In those 2 days, please, for those who are attending, I'm telling you, please see to that you have space, wherever you are sitting, please see to that you are fully physically, emotionally, and mentally present there. And we will start the session only when all the participants open up their videos. This is not going to be a meetup where, so many people can hide behind the videos, switch off the cameras. This is for those people who can commit their 2 days for their own healing. I am, my clinical practice on Saturdays are like big rush. We are skipping that Saturdays ka practice. And one of the, beautiful days I enjoy in a week is Sunday. I am skipping that Sunday every month. And this month is going to be 11th and 12th of October. And that is why we want you to be there, so that this we are doing it for you. This is for your healing. This is for your yeah, emotional understanding. This is for that. Yeah, you already enrolled for it, but those people, somebody of you might not have been enrolling, so you can also enroll in using this. If you have not informed earlier or you have not received the messages, you can just enroll in the same Google form. We'll take some time before we close. I will go with the medicine mistakes, whatever medicine, like when you take the medicines, what are mistakes you are keeping. I'll go with that. But before that, I just want you to share if you have some queries regarding the treatment, or I heard some questions in the chat box. I'm just looking those questions. If you have some questions, you can just type it in the chat box so that we can I can help you with the answers with that. Right. Siddhartha has asked me, yeah, how are the medicines helping to manage these inner triggers? Yeah. Medicines, actually, homeopathy medicines have the effectiveness for not only physical things or physical diseases, but it also have this kind of an action, which is we call this as constitutional medicines or constitutional effects, where the medicines will actually help you with the inner healing as well. But don't depend only on the medication. That is what my experience is telling you. So my experience is that along with the medications, when you are ready to have a committed and focused therapeutic process or therapeutic procedures, which we will teach you in Swasti sessions, that is going to speed up your healing. The persons who have attended Swasti batch, persons who have attended along with the medications, they get back on me telling that it is the speed is actually 2x or 3x. The speed of the medicines which is acting and the speed of the awareness that we are getting is very much faster, and that is how you speed up the progress, and that is how fast you will get out of the stuckness you are in. Right. So yeah, Deepa is asking me, doctor, just wanted to know, do I need to stop my migraine medicines if I have fever, considering I'll be taking other medicines? Yes, Deepa, good question. See, Deepa, I've told you, even if you have fever, you are permitted to take a paracetamol or a crocin for that matter, because you are from, most of you are from far away, distant places. So my medicines might take about 1 or 2 days to reach you. And if you're very particular that you need fever medicines to keep it at hand, we are ready to send it beforehand itself. Otherwise, if you have fever, please feel free to have a paracetamol or a crocin. There is no harm in that. But if you are consulting a doctor, like if you have chest congestions, if you have runny nose, sneezing, or gastritis, or some other issues, if you are visiting a doctor, please see to that they are not prescribing any antihistamines, because there is a normal tendency of every doctor when you are coming with fever or cold or something, they will prescribe some things like montelukast, citrazines, allergic medicines, allegra tablets, or even cough syrups. So I don't want you to take those medicines. Even antibiotics is fine. Okay, if you are to take an antibiotic dose for 3 or 4 days, that is also fine with me. And don't stop the medicines. Don't stop our medicines. You can continue along with the other medicines itself. Don't worry about that. Right. Can I take headache drops multiple times in a day when headache triggered more than once a day? Arishi Gupta, please hold on. I'll get back to that question. What I have to do after taking 10 drops 10 times and painkillers, still I have headache. Amanullah, I'm coming there. We are going to discuss deep on that. Pachiamal, sir, I'm taking medicine since 3 months. In 3 months, I have no headache, but in this week, it's coming persist for 1 week. But I have experienced my headache present 1 month. I'm scared if it persists as same as before. Okay, Pachiamal, it is just a scary thing. Okay, it is just your anxiety. It is just your thoughts that you are finding it like you don't have headache since last 3 years, and you are telling that you have a headache since few days, and you are scared that it might persist. Okay, so when you have headache, what you have to do, I'll give a small flow chart. I'll give you a thing. Please hold on. Shilpa is asking, Dr. Naxdom, how much can I take in a day? Okay, right. Please repeat the three rules of medicine. I remember only not to take cold. Sitara. Okay. I can do that for Sitara. Sitara, there are only three rules. Okay. Three instructions I give you. One is avoid cold in every manner. Don't apply ice on the face. Don't apply ice on the head. Don't take anything cold like cold ice creams, cold milkshakes, cold coffees, etc. Don't have anything like cold compress or something. Some people apply ice on the face when they have headache. Don't do that. Okay, you might have heard neurologist also asking you to do this, but I am dead against that because when you have some ice applications on your face, you are actually numbing your nerves. You are numbing your nerves as well as you are constricting your vascularity, the blood vessels, and you will feel better for some time. Definitely, you will feel better for some time. But in turn, you are actually fueling the inflammation inside. I don't want you to do that because we are trying to bring down the inflammation, which is chronic in nature. And I definitely don't want the inflammation to go high because you are doing something against the medicines. So that is why we are telling no cold things. And this is an instruction to be followed not for life. Once you're out of the medicines, once you're like stop the medicines, you are okay with, you don't have headaches since last 3 4 months, we've stopped the medicines. Please understand, you can have ice creams and milkshakes later on. There is no harm. It is not for lifetime. You have to keep up this. Okay, that is the first instruction. Second one, no balms whatsoever. Tiger balm, Vicks, roll-ons, Amardanjan, Zandu balm, eucalyptus, axe oil, nothing. Okay, so no balms. I'll tell you the reason why. Why? Because these balms have an innate nature of the chemicals which is having. These balms will actually turn your nasal phlegm and nasal inflammation to the sinus inflammation because this will put everything towards the sinus. Even if you apply balm on the forehead, even if you apply balm on the neck area also, this can go inside the body. Please understand, everything you apply on the skin is getting absorbed inside the body. It is nothing is like there outside the body. Our skin is completely porous. So if you apply something on the skin, it is going inside. Once it gets inside, the inflammation part, it is actually triggering. That is why once you are a Vicks addict, you are a Vicks addict for life. Once you start to use an inhaler or use some balms or something, you are actually addict for life because you don't have a way out. So please understand, this is for life. I'm telling you, never use balms. Even if you have a cold, even if you have a bad headache, even if you have a back pain or muscular things, anything, do not use any balms. That is my second instruction. Third one, do not use any antihistamine medications like Allegra, Montelukast, Citrusins, Montacalci kind of stuff. And along with that, I've added like I some people I forgot maybe. Don't use any nasal sprays also. Okay, even if you have nasal congestions, even if you have sneezing, don't use any anti-allergic medicines. If you have sneezing, sit and sneeze for 2 days. If the sneezing is more and you are not able to go to office, let me know. I'll send you the medicines and you'll be fine. Trust me on this. Okay, I can send you the medicines, which is not antihistaminic in nature. I can send you medicines for cold and sneezing and cough and asthma and whatever problems you have. Trust me with this. I'm telling you why, because people sometimes think that, sir, homeopathy, no, it will take so much time. I have taken homeopathy for cold and it was not better. I have taken homeopathy for cough and it was not better. Try my medicines and let me know. That is a challenge I'm putting forward to you. You have cough, starting itself, you tell me, don't take cough syrups. Don't take antihistamines. You let me know, I'll give medicines. It is not that whatever disease you have to come to me, only you have to get medicines for me. Not, that is not the concept at all. I'm okay with you going to a doctor and taking an antibiotic course also. That is fine with me. I don't have any problems. We are not against any system of medicine. We are only against those things which you do so that you are again aggravating the migraine issue, which we are trying to heal. Don't do these three things. And the only instruction which I give is, other than these three things, you have to maintain a migraine diary. You have to write down how many ever months you are taking my treatment. Please keep up a diary, or maybe in the iPhone, or maybe in the notepad or something. Please keep an up-to-date diary. And some people, like 2 days back, I spoke to somebody and they told me that, so last 4 months I'm taking treatment and I was better. This month I had 2 episodes of headache, so I lost hope and I threw away my migraine diary. Don't do that. Please don't do that. Okay, please stick on with the treatment. Please stick on with the thing, and that is how we know that how the cure is happening. That is the only thing that we can test. That is the only thing that you know for evidence. Some people call me and tell, sir, headache is better. You send me medicines. I will ask them how many days it pains. Sir, most of the days pain was there, but I was better. This he is telling since every 2 months he is telling all these same things. We don't know any quantified thing. We require quantification. That is how we treat you with the evidence-based medicine. So we review this migraine diary every week so that we should know how we are getting better. And you are able to see that diary yourself, and you will come to know that the frequency is better, or the duration has come down, or even the intensity of headache is better. So migraine diary keeping up is very, very important. And going on to the very important question, there are a lot of questions coming up. By the way, sir, मैं बहुत ज्यादा बीमार हो रही हो, मुझे अभी तक वाटर बॉटल ज्यादा, I feel no medicine for me. Swati Singh, I'm not getting you what you're telling. Whenever I think of migraine or hear the word, I feel like crying. Shilpa, Swasti is for you. Because of the sufferings, how to stop it? Even now, I feel like crying. See, uh, this is what our society tells you when you tell somebody that you feels like crying. The society tells you that, see, let me just check. I can see only my team members and my doctors in the room. Is there somebody else in the room? Can I see some more videos? There are almost like 40 people in the room, and I can see only four faces. Shilpa, Riddhi, and Arushi. That's all I can see. Divya, Amanullah also. Yeah. If you're here, please give me a hi in the chat box at least. Or am I talking to all blank spaces? People are switching on the video, and people are giving hi also. Fine. See, what I was about to tell you is, see, somebody somebody tells me that I'm feeling like crying. The normal people will actually tell you, no, you'll be all right, don't cry, and you deviate to something else. You focus on your career, you focus on education, you focus on your family, be with your kids, and you will feel better. Be with your friends, hang out, go for parties. These are all fake concepts. Please take it from me. The only thing that will help you is, if you feel like crying, please take time to feel it. Please take time to cry. And that is the only healing you might require. And if you tell me that, sir, I am crying all the time, still that headache is persisting, we'll help you. Don't worry. There are different layers. There are different layers and problems and issues that we should be dealing with. It's not a one fixed solution for all. So please understand, if you feel that heaviness here, if you feel the heaviness in the chest, if you can sit and feel for yourself, if you can take a time out, we call it me time. This is a usual term where GCC countries and US based countries know. We Indians, we don't know what is me time. Mm. We have to take me times. We have to take time off from our daily routines so that we can sit and feel what you are feeling. Please honor your feelings. That is the only thing that you know of yourself. Yeah, Arushi, that we'll deal in Swasti. Arushi, don't worry about that. Yeah, I see. I know why people are telling that I cry a lot over small things, because you're almost full. See, this is a water bottle. You can see when the water is full, if we try to put anything more, this will spill off. Okay, that is what is happening. People tell me that I watch reels and I cry. Okay, I get a WhatsApp message telling that someone expired, and I start crying here. It is like you can't even bear the slightest of emotions or slightest of triggers. You're not able to bear. And there are people who tell me that actually I heard bad news. I heard something pathetic, and I started to shout. Okay, I started to scream at my kids. See, these are called as displaced emotions. When you're actually feeling sad inside, you are getting angry. When you're actually feeling grief inside, you are not able to bring it out, but actually you are bringing out anger or irritability. These are called as displaced emotions. We will deal with this in Swasti. Please be there. That is why I want you to be there. That is how deep and important the journey of healing is. And people always relate with, I have migraine, sir, I'm getting angry. And neurologists will tell you, getting angry and migraine is always a common symptom. All migraine patients are like this, don't worry. That is because of you have migraine. And some doctors are there who tell you that when you're having migraine, your blood pressure is shooting up. So when your blood pressure is shooting up, you have anger issues. It can be the other way around also. It can be the other way around also. It's only when your emotions and anger is out of control, you can have blood pressure increase or you can have migraines and you can have pains. So please understand there is always a clue. There is always a clue which body is telling you how on the way how you behave. Right. So going on to the next question, like Shruti, sir, now I feel better than before. As per the drug orders, now I have sneeze, a sign to become fever. I remember your strict order, don't take allergens like citizen. Then what can I do? Any remedy to sneeze? Shruti Rajesh, you can connect with me tomorrow. We'll catch up on a call tomorrow morning. Let me know in the WhatsApp message that you want to connect in tomorrow morning. We'll talk to you personally regarding that. I can see what medicine I can send for you. Okay. Please see to that you're messaging it right away and get an appointment for call connect tomorrow morning. On an average, how long does one need to take these medications? Shobha Varghese, I'm coming. Okay, you are asking about general medications. Okay, fine. I can't predict that, Shobha. I'll tell you, there are people who have been completely healed within 1 month of medications also. You trust me or not, we have a lot of people who have done that. There are people who are still continuing their medications even after 8 to 10 months also. But nobody will continue the medications if they don't find it effective. Nobody will find fun in buying the medicines even after 8 to 9 months if it has not done them any good. So I cannot predict that on an average how long you will have to take, because there is no average at all. If you're asking me that question, I would ask you back, what is the average intensity of sadness a human being is having? We are almost like 38 people sitting here, and we don't have an average, because that is not really possible, because each one of our life is individualistic. Each one of our life is different, and the severity and the layers of things which we have gone through is different. So there is nothing like an average. But one thing I can vouch on, one thing I can clearly tell you is that if you obey the instructions, if you take the medicines religiously, you will find the changes in your body happening within 6 to 8 weeks. That is my word. Within 6 to 8 weeks, you will start observing that, okay, these medicines are acting. I'm finding change. It is not that you will not feel headache anymore. You will have headaches because that has been there for 30 years now. So definitely within 4 to 8 weeks or 6 to 8 weeks, I would tell, you will find the changes happening. That is all I can tell you. And it really depends upon people to people. It really depends upon how many layers of things you will have to heal. That is the real answer for that. Every day when I wake up, I feel headache for at least 20 minutes. How to get out of it? Please reply, Divya. Right. See, every day when you get a headache while you open your eyes, there are only few reasons for this. First one is that please check whether are you putting fan in full speed or are you putting AC along with the fan. If you're doing either of these, you have a tendency of getting the sinus and the nasal passages dry because the moisture content will come down because you're putting the fan in the full speed. Or if you're putting an AC alongside, you're putting a fan also. So it is not advisable to do these things, but it is always better to put the fan in like 3 or 4, not in the maximum speed. And if you're putting AC, please see to that either you're switching it off within 2 or 3 hours, you are putting an automatic switch off system or something, or you can put it in 26 or 27 degrees, not below than that. And you can anyway the AC and the full speed fan is always have causing such kind of problems. Like when you open your eyes itself, you have having that condition. So what you have to do is when you open your eyes, if you have that vaporizer machine or something that what we do for steam inhalation, if you have that, switch it on, get a steam inhalation for 5 to 10 minutes, and you will definitely feel better because you are giving warmth. You were in the cold, and you were lying down and you were having that cold, dry air all the while for 8 to 9 hours. So if you have some kind of warmth, or if you have some warm drinks, or even if you can wash your face with warm water, that is going to definitely help you. So I would really ask you to have a steam inhalation early in the morning if at all you are facing this problem. And if at all that is continuing as a headache, please see to that you are continuing or starting the headache drops as such, as the prescription is telling you. Right, sir, I'm taking glucose water bottle. I'm feeling low. Okay, that is good. And I'm having too much stress. I cry a lot. You're right, sir. Okay, I'm facing such situations. Okay. Is it okay I resume fertility treatment after 4 months along with the treatment? Gokula Bharati, it is purely okay to continue any treatment you are having. If you are having diabetes, it is okay to continue the treatment. If you want to continue with the fertility treatment, it is okay. There is no harm. But please understand that, like today, I got a call from a person from Bombay or somewhere in North, and she was telling that she got pregnant last 10 days back. She got to know that she got pregnant, and her gynec have asked not to take any other medicines. Please understand, if somebody of you is planning for a pregnancy, homeopathy is the best medicine that you can have, best ever medicine that you can have during pregnancy. You are not supposed to take any painkillers. Please understand this. So please don't stop. If at all you are getting pregnant, please continue with the medications so that your pregnancy will be, period will be, migraine free. Otherwise, you will have more headaches because you will have that hormonal imbalances. You will have all sort of issues with your appetite, vomiting, and stuff like that. And also, you will have issues with sleep, and this will trigger your migraine. And those migraines you will not be able to manage with any painkillers. So it is always advisable to have a homeopathic treatment when in pregnancy also, especially for migraine, even in breastfeeding. It is totally safe for a breastfeeding mother also to take homeopathic medicines. Yeah. I'm having migraine currently, which is due to cough and cold and fever. I mean, whatever happens in my life, it adverse affects first migraine. What to do? Please guide. Harshada. Okay. See, first of all, I would tell you, Harshada, don't call every headache in your life as migraine. That is the first instruction I give you. Okay. Never think that every headache is a migraine. There are hundreds of headache a person can get, and only few are migraines. It is not that every headache not equal to migraine. Migraine not equal to headache. Please understand. So when you're having cough and cold, I would generally tell an example like, suppose you are not very much used to physical activity, and day after, like for tomorrow and day after, you are going in a paddy field and working for about 8 to 12 hours, or you are plowing and you are using all the heavy hard tools in the ground, and you're working in a farm or something. On the second day you will fall sick. On the second day you will have back pain, or you will have pain in the shoulder and stuff like that. That is not a disease as such. That is the problem which you have created of yourself. So that is not a disease which you need to take medicines. That is a problem which has come due to the exertion. So when people come up with migraine, they ask me always like, see, I spend whole night watching movies, or I didn't sleep for 2 days, and next day I'm getting migraine. Please understand that is not migraine. That is the headache which you are getting. Every human being will get if you are not sleeping for 2 o'clock till 2 o'clock in the morning, and if you are get waking up at 5 o'clock in the morning, and if you are trying to travel after that, it is quite common for you to get a headache. So please don't think these are stress-based things. These are your environmental-based things. So these are not migraines. This doesn't come under the purview of treatment. Please understand. But definitely, if you are a person who is having migraines or headaches every time you get a cold or cough, definitely this will help you. Definitely, this medicine is going to help you. Right. Do you also help with other ailments apart from migraines? I have heard homeopathy helps our pyronial sinus. Let me know. I can take appointment for this. Sitara, definitely. I am a homeopathic postgraduate doctor. I finished my BHMS and MD in general medicine. I treat everything from cold to cancer, but I focus on migraine since last many years. So please understand, we have a hospital, we have multiple doctors here, and I do take up every cases. Okay, migraine is my specialty. That is where I focus. I do treat every cases. Please understand that. You can connect with me for that. And sir, now I have back pain and pain goes to my legs. I'm not standing properly. Okay, Swati, I got you. Yeah, the scene during steam inhalation, medicine, nostril dries up, and burning sensation occurs. Okay, yeah, I'll come to that. Sir, I'm taking medicine 3 months and no headache. Okay. Pachimal, I already responded, for that question in very detailed manner. I'm sorry if you didn't hear that. Does walking or any kind of physical activity help in migraine, as some neurologists suggest? See, one thing I will tell you, I respect all these neurologists. I respect all these people, ENT surgeons and neurologists. Please understand, these people are trying to manage the pain. Okay. Will walking help? Yes. Will yoga help? Yes. Will painkillers help? Yes. But will it help to reduce the pain intensity, or will it help to reduce the frequency of pain? No. Absolutely not. Will walking reduce your migraines? No. If that was the case, most of the people on earth would not have migraine at all. Please understand, these are the like, does putting legs in warm water help you to relieve pain? Yes. But is that a cure? No. Okay. Sipping hot coffee with salt in it, will it help to relieve the pain? Yes. Is it a cure? No. So don't try all these gimmicks. You walk for your health. You walk for your getting exercise. You walk for the calorie loss. That's all good. Don't walk for getting cured out of migraine. Even if Bhagavan tells you, not only neurologist, even if God comes and tells you that walking helps to cure migraine, don't trust. Okay, these are all gimmicks. These are all some management techniques people are, asking you to do. I have seen plenty of neurologists, with all respect to their profession. I have seen plenty of people who come and sit in YouTube videos and tell you things like this. Apply ice on the face. They have not seen people who are suffering really. That is my stand on this. And there are doctors who tell you to put the water in, like warm water in your leg. At the same time, put ice on the head also. This will help. Definitely, this will help for some time. I'm not telling you this will not help. This will help. How it is helping? It is not magic. When you put the legs in the warm water, actually the vasodilatation is happening. The legs in the blood vessels in the legs are getting swollen, and the blood flow will be more towards the leg, so that the blood flow from the head will come down, so that you will feel a calmness. Definitely. And when you apply ice on the head, also same thing is happening. Vasoconstriction is happening on the head, so that the blood flow will be less and the nerves will be numb. But does it heal or cure migraine? No. So please don't attempt any things like this. Okay, there are multiple things which you get it from internet and social medias. So I'll come to the last part before I close this. I will tell you. Yeah, what is happening when you take headache drops? See, I have seen multiple people who tell me that I tried headache drops as you have mentioned, and I'm not getting results. And I will give you a flow chart. Whenever you have pain, please by heart this flow chart, and please abide with these instructions religiously, and you will see the result. See, for example, 10 o'clock, you are starting to have your pain. 10 o'clock in the morning, you're starting to have your pain. I want you to grab the headache drops right at 10 o'clock. Start it. Take it every 10 minutes, like 10 drops on the tongue. You have to take it. Every 10 minutes you take. For 10 to 15 times, you have to take it continuously. And during that period, I don't want you to be in an argument, be in a phone call, be in a bank, be in some traveling, be in some other big arguments or conversations, because I want you to be grounded, if possible. I'm adding that clause if possible. See, if it is 8 o'clock in the morning and you have to be in the kitchen, be in the kitchen. Otherwise, your family will be like, out of food. So, there are things which is possible and which is not possible. So, if possible, I would ask you to go somewhere, sit silently in a room, take this headache drops, and the effectiveness is 3x. I would tell you. So people in working in bank and in software companies, they tell me that I was in a team meeting and I took these drops every 10 minutes, 10 times, and nothing worked. They are sitting in a bank, dealing with the customers and angry boss, and they are sitting and dealing with all these cash dealings. They are taking these headache drops, nothing works. I know it will not work because this is not a chemical painkiller which is shutting down your brain centers, or this is not a sedative which can put you to sleep. These are not chemical medicines. These are just pure, simple homeopathic medicines which will help you to bring down the inflammation. And once you settle down, like people usually tell me that I tried it for 10 days, 10 minutes, sir. 10 times also I took, but I was not feeling better, or the pain still remained. Please understand, this is not a painkiller. We have mentioned like headache drops. It is not a painkiller. When you take a painkiller, the pain comes down like this. When you take a headache drops, the pain goes down like this. Okay, this is a graphical representation. Please understand. Don't ask yourself when you're taking a headache drops whether my headache is gone. No. Okay, again you take it 2 times. Whether my headache is gone. No. Again you take it 2 times. That is not the way. You have to ask yourself whether I'm getting better. Ask yourself whether the pain is coming down. Don't ask yourself whether I'm out of pain. Okay, this is not a painkiller. This will not put you to sleep. This will not put you to sedation. Where when you take an Axdom or a Vasograin or a headset or something like that, you will feel that within half an hour to 45 minutes, the pain is like gone, vanished into thin air. That will not happen. But definitely, my statistics of last 20 years is like 7 out of 10 headaches will be better with this headache drops. And till date, nobody have broken the statistics. 7 out of 10 means 7 out of 10. If it is not acting for 7 out of 10 pains for any of you in this room, connect with me. I'll help you with that. I can challenge you with this. 7 out of 10 pains will be better with this headache drops. And maybe in first month or second month, you will have to take painkillers for 1 or 2 times. And how to take painkillers, I'll tell you. I have seen most of the people, they start the headache drops late. First, they will test themselves. First, they will start praying. First, they will try coffee. First, they will sit somewhere silently and try Bhagwan's blessing that the headache is going on of its own without even the help of headache drops. Then that will be a lapse of 1 hour. Okay. Then they will start the headache drops. Then it will not act. Please understand, it will not act. Don't blame me for this. Okay, so that is why I want you to carry this when you go out for shopping. I want you to carry this when you're driving or when you're going out to pick your son from school. Okay, please have this at hand. You have to start it. Even some people ask me, sir, I have some kind of an aura feeling where I know within half an hour my pain starts. I tell that if you have that aura kind of feeling and you feel that within 15 minutes the pain is starting, you start the headache drops then itself. And most of the pain, you will understand that pain is not come only. Most of the times you will feel that, okay, I didn't get the pain only. I took it for 3-4 times and the pain didn't turn up. This is the experience which I have with my patients. So please understand, the point number one is you have to start on the right on the dot moment and only take it for 12 times or 15 times max. But minimum it is 12 or 15 times. If you're really better out of the pain, like in 5 or 6 times, I'm okay with you stopping the medicines. Like 5 times you took and you're like perfectly fine. Stop it. Fine. But 5 times you took, you are not better, don't stop it. Take it for 12 times. Okay, 9 times you took, you are not better, don't stop it. Take it for 12 times. Okay, so 12 to 15 times is like 2 hours. And after 2 hours, I want you to check with yourself whether I am better, like whether the pain has come down, whether the intensity has come down. If it has come down, take it for maybe 3 or 4 times and take rest, and most of the headaches will go with that. If at all, after 2 hours, you are feeling like the pain is really hitting you hard, like 2 hours, after 2 hours also, the pain is really severe. I want you to take Naxdom 500 then and there. What most people will do? No, sir, painkillers, I have read somewhere like if I take painkillers, my kidney will go, my liver will be damaged, so I don't take painkillers. Please understand, I know that. Please understand, I'm not a quack who is just asking you to take painkillers whenever you want. I'm not doing that. I have certain intentions of asking you to take painkiller whenever I ask you to. If the pain is more after 2 hours, please see to that on the end of the second hour, you have to take an extra 500. And you will find that within 45 minutes, you will be fine. If you are delaying the intake of painkiller for an hour, whatever painkiller you take, you will not be better. And don't blame me. And don't blame the fate. Don't blame the stars telling that I took your medicine, sir. I was not better. I took painkiller also. I was not better. Then after 6 hours, you will go to hospital. Injection also will not do good because by that time, the inflammation has spread to the whole body. Whatever injection or Botox injection also you take, you will suffer for 3 days continuous minimum. Please understand this is what we observe. Don't try your home remedies in between. People have telling me like, sir, after taking headache drops, headache was not better. So I drank a coffee. I tried to sleep. I tried to listen to music. Enough of all that things. Enough of all your suggestions. Just stick on with it. And the end process or the end job you have to do is please write in the headache diary about the intensity, duration, and the pain date, whichever date you had pain, how was the intensity and how was the duration, and write down which medicine you took that day. If you have taken Naxdom, you write Naxdom. If you have gone to a hospital and taken a diclo injection, write down it is a diclo injection. That is the process that you have to stick on to. Don't ever think anything else. Please stick on to this process, and every month you will see that the need of painkiller is coming down. Every month you will see that the intensity and the duration of the pain is coming down. Every month you will find that the frequency is coming down if you stick on with it. Because I'm not asking you to take painkillers for life. Most of the people tell me that within 2 months, I don't need a painkiller now, sir. I'm okay with headache drops itself. Then they will tell that now I don't need to take headache drops 10 times, sir. Within 5 to 6 times, I'm better. And next month they'll tell me that, sir, I am getting afraid that whether I'll get headache, but I am not getting headaches. I went out in sun, I came back, but I was afraid that whether I'll get headache. I took the painkiller also in hand, but I didn't take it, but I never got a headache. So that is how the healing happens. So please stick on with the instructions given 100%. Religiously, I want you to stick on with the instructions. I don't want anyone to have any faulty techniques. I don't want anyone to try some other gimmicky methods. People tell me that I tied my head, I applied ice. Don't do that. Just do this every time you have a headache and count the numbers. And you will find that you will understand that you are getting better every month. So there are few things. Okay, super nice telling. It's been around 20 days since I started my medications. I have headache trigger once during this time. I'm hoping to see more improvement within consistent use of medication. However, I notice for the day or two after the headache, I feel a bit low and experience some dizziness. Is this normal? And anything? Okay. See, feeling dizzy and feeling that head congestion is there. Feeling that some people tell me that after 20 days of medications, I'm getting phlegm in the throat. People might tell that after 20 days of medications, I might have neck pains. I am starting to sneeze. I am getting fever. Everything is normal. Please get back to me. If you have an issue, send me a voice message in the WhatsApp and we'll get back to you. So don't worry about all these things. It's completely normal to have a fever or it's completely normal to have a neck pain once you start the medicines. Okay, you're on the process of healing. Please understand that. Yeah, and I feel headache. It's not progressing, relieving as a sedative effect, but it's good. I'm carrying with myself everywhere existing. Okay, fine. In between taking drops, if I'm vomiting, should I start again? Can I take any medicine for vomiting? Okay, fine. Shilpa, when you connect with me, tell me about the vomiting issue also. And there are some people who tell me that, very few, like less than 5 to 7% of the people who tell me that as soon as I take headache drops, or I took headache drops for 5 times and I feel like nauseating. I feel like vomiting because of that medicine. Please understand the nausea feeling and the vomiting sensation you are getting is not due to the medicine, it is due to the pain. It has got nothing to do with medicine. Please understand. So people try to avoid that medicine, telling that when I take the medicine, I'm getting vomiting sensation. It is not due to the medicine. It is due to the pain. Okay. When the pain is getting intense, you might feel like nauseating. You might feel like vomiting. So please understand, take the medicines as I have instructed. And also regarding the steam inhalation, I have observed that some people do not do the steam inhalation. They think that I don't have any nasal issues, I don't have any sinus issues. Why I should take inhalation for migraine? Please understand, I know this disease better, far much better than you, and I have seen cases, thousands and thousands of cases. So I know how to deal with this. Trust me with the prescription, trust me with the inhalation stuff. And if you feel that you are getting aggravated because of the steam inhalation, let me know, but please continue it. Don't stop it. Like first few days, like first 5 to 7 days, you might feel like the congestion is more, the heaviness is getting more. Let me know what is happening. We have a 24/7 like online connect mechanism in WhatsApp where you can connect and approach to me and tell me what is happening. So we are happy to guide you. Instead of that, you are trying things like I had that nasal congestion, so I applied some nasal sprays. I had this nasal congestion, so I went in for nasal drops or something. Don't use all these things. In between taking drops, if I'm okay, can I take headache drops multiple times in a day when the headache is triggered more than once a day? Yes, you can, Arishi. You can. Definitely you can take. See, headache drops is I'll tell you, it is a water-based medicine. Okay, so it is a very, very ultra-diluted medicine. You can take how many ever times you want. See, earlier, like 10 years back, when I used to treat migraine patients, I never used to tell that you have to stop with 2 hours. I used to tell them to continue with it till the moment you are better. Okay. Nowadays, I'm not doing that because people are more impatient now. They want to get result then and there. So I have shortened the duration of the medicine to 2 hours, and I am telling them stop in 2 hours. But after 3 hours, if you are again having that pain, it is okay for that you to continue the medications. There is no harm in that. Okay, absolutely no harm in that. And but if you are not better, don't just stick on with headache drops. That is the whole point. Okay, if after 2 hours of medicine and 3 hours of medicine you are not better, stop it. Take an anti-inflammatory. Naxdom 500 is the best one, which I suggest, and you will be better. Priyanka, I have started medicine taking today. I feel sleepy whole day. Is it because of the medicine? No, absolutely not. I'll tell you. See, these things. Thank you, Priyanka, for showing that courage to ask me that. You have started the medicine and you are feeling sleepy. Please understand, when you take homeopathic medicines, you might feel increase in appetite, you might feel sleepy, you might feel calmness, and more that you are having better sleep or you're feeling drowsy in the mornings. It is not because that medicines are having some sedative effect. Our medicines don't sedate at all. The problem or the real thing what is happening within you is, once you start to take medicines, the process of healing triggers. Trust me with this, the process of healing triggers, and people often report to us like, sir, you have given me migraine medicines only, but nowadays my gastric issues are getting cured. I had lot of flatulence, I had lot of bloating, but nowadays my digestion is getting improved. Nowadays my bowel cycles are getting improved. Nowadays my periods are getting regularized. These things happen because we don't just give some neurological medicine which is acting on the nerves, but we give medicines which is constitutional based. So when you're feeling like when you're starting the medicine, you are like feeling to sleep more, please understand your body requires rest, and the body is triggered to respond. So some people tell me that I have yawning more. So if you start to yawn, please understand that your body is trying to release certain things. That is a psychological symbolism of yawning. Please understand, yawning has its own meaning in the case of migraine, even in the case of psychological traumas. So if you are yawning, if you are feeling sleepy, please understand your body requires rest. Why you feel sleepy when you are having fever? Why you are feeling sleepy when you have a lot of inflammation? That is the same process that what is happening inside you. So when you start doing something for your body will start to take proper rest. So body will incline yourself or push yourself to take rest. If that is happening, take 2 days ka rest, sleep off, take lots of water, take lots of natural foods and fruits, and you will be generally be better. So there is nothing like our medicines are causing you to sleep or our medicines are causing you some acidity or something. There is no homeopathic medicines which can cause acidity or gastritis or something. Yeah, and connect back with us if you are feeling any such symptoms. There is no medicine for which can induce gastritis or something, because we are so used to allopathic medicines which always cause gastritis. So we think all medicines are of a similar kind, and people always complain that after starting your medicines I am starting to feel giddy because that is a higher dose. It is not, and it cannot produce some adverse effect like that. So take the medicines as it is advised, and this is the instruction which I have to tell you. When you take a headache drops, so many people I have seen, people are taking it in a wrong manner, and we are finding it difficult to answer or all these things in a one-to-one calls. That is why I am putting in such sessions where we can tell it to one to many, so that we can reach to maximum people. And feel free to connect with us, because we don't have a mechanism. We have patients from almost like 18 19 states in India, and we serve people across 44 countries since last 20 years. So please understand, it is not possible to call up and ask each one of you how are you doing on a daily basis or on a monthly basis also. Please see to that. Feel free to connect with us in WhatsApp. If you send a message, there will be delays, but there will not be any denials. We see to that every messages are getting responded. If you don't get a reply within 4 to 5 hours, please get us a hi again, because there are like almost 300 to 400 message it is coming and bombarding the WhatsApp. So your messages might go down, and we might it is not that we are ignoring your message. Please see to that you are sending us a hi again, and we are happy to serve you. And if you need to connect with us also, we are available. Please understand, it's always better to connect in WhatsApp through a voice message or something, so that we can directly reply to you. My team of doctors are ready to reply to you that, and they will ask me all the questions, and they'll make me here. And I am also responding to WhatsApp messages on a daily basis, at least on once in 24 hours. I see to that all the queries in the WhatsApp is getting answered. So we have a process, and we have a team who is looking after all these things. And before you log out, please make sure that you are committed and you are focused on your personal journey. Because as a doctor, I would tell you, if I give medicines, you are taking. That is fine. Okay, I can make you take the medicines, I can make you bring down the inflammation. That is from my part. But the commitment from your part is how committed and focused are you, or how you want yourself to be healed. That is a commitment that you show in attending programs like Swasti and subsequent programs. Because that program, I cannot force you to be there. Okay, there is no point that I am I am running behind you and asking you to be there, whatever happens. No, it is your commitment. It is the commitment that you are showing to yourself. Please understand that sessions are significantly helping people of migraine to heal themselves, of their old wounds, so that they come out of the pain forever. Please understand, that is why I am repeatedly telling you to be there for the session, and you will understand why I am stressing this so much. And hope to see you all in the session. So we have taken almost like 30-35 minutes extra. Sorry for that. I could not resist answering all the questions because there were so many questions in the chat box. So thank you very much for joining. We have this regular meetups for you to interact with me personally, because I may not be available for calls on every day basis. Though WhatsApp, I'm trying to see as much as possible, but I'm not able to return to calls. That is why we have a trained team of doctors in our panel. And every month we'll have a patient meetup. and that will be informed to you. So every month you will have an opportunity directly. You can ask me questions, whatever problems you are facing in your healing journey. Please feel free to be here. This is for your sake. We are doing it. This is for your sake. So we are available every month, at least once in a month. We are so in coming months also we will be fixing the dates earlier, and we'll be announcing that. So which is the date for the patient meetup. So we'll be continuously doing this on every month basis. So please see to that you are making most use of it, and happy to serve you in all possible ways. So thank you very much for joining us, each one of you, those who have switched on the cameras and those who were hiding behind the cameras. I love you all. Thank you very much, and see you in Swasti and without fail, and get well soon and have a good night. Bye.